Your scene is safe.
Okay. I'm walking in for my general impression. What do I see?
You see, as you see it, a person in no distress.
Okay, seated patient. My skin signs appear warm, dry, or diaphoretic.
Exactly how you see it.
Exactly how you see it. Okay. Hello, sir. My name is Jenna with the fire department.
Jenna, let's pause.
Yes, sir.
This is what I don't want you to do, and this is why. I want you to evaluate your patient from the door,
Okay.
get level of consciousness, what you did,
Okay.
and then evaluate their ABCs before you approach.
Okay.
What you did is you said level of consciousness, skin signs, and then you're touching and talking.
Okay.
The problem with that is if I give you a patient that's visibly short of breath, start huffing and puffing, you need to identify that. It's not like that. It's like, you're going to be able to identify that from the door.
Okay.
And then in your mind, oxygen, non-rebreather mask, medic unit.
Okay.
Before you even go talkie-talkie.
Okay.
If you don't do that ABC thing from the door every time, you're going to walk up. They'll be breathing hard and you're not going to intervene to save them because you're busy talking to them.
Okay.
Okay.
Okay. So I have one male patient, skin signs appear warm, pink, and dry.
Yep.
I can see that he is breathing normally.
Correct.
His ABCs are intact at this time.
Talk about his airway. His airway's
His
intact.
airway is intact. His C's.
breathing is normal.
Breathing is normal.
Because when I give you the patient that's unconscious on the ground, your brain should say, I need to open his airway. His airway is not controlled because he's unconscious. And make a plan to do it.
Okay.
His breathing is agonal, which means I need to intervene with the bag valve mask. Right? You need to make those decisions based on thinking about airway, breathing, circulation before you even get talkie-talkie on them.
Okay. Okay, so at this time, I'm not going to upgrade to ALS, but I'm going to investigate further.
Wonderful.
Okay. Hello, sir. My name is Jenna with the fire department. What's going on today?
I was mowing the lawn and all of a sudden I had really bad chest pain.
You had chest pain?
Yeah,
Okay.
it kind of started hurting up in my jaw.
Okay, all right. Partner, can you go ahead and get a set of vitals on Casey? So my partner's just getting a set of vitals on you, okay?
Okay.
Prior to a 322, can we get a medic unit up in here for chest pain?
Okay.
Okay. So when did this start?
Probably about 45 minutes ago.
45 minutes ago? Okay, and what were you doing when it started happening?
I was mowing the lawn.
You're mowing the lawn? Okay. What does it feel like? If we were to recreate it on you, does it feel like crushing pain? Does it feel sharp?
Yeah, it feels kind of like crushing pain. And then it started right in the middle of my chest and went up to my jaw.
So you said it goes up to your jaw? Does it go anywhere else? Down your arm, into your back?
No, I don't think so, no.
Just up in your jaw, okay. And what would you rate this on a scale of 1 to 10 for pain, 0 being absolutely nothing, and 10 being the worst pain you've ever been in?
10.
10? Okay. And how long did you say this has been going on for?
About 45 minutes.
Okay. Has this ever happened to you before?
Yeah, I had a heart attack before in the past.
You have had a heart attack. Okay. So what we're going to do is we're going to have the medics come in and check you out, okay? And then we're going to get you to the hospital for them to check you out as well. All right. So at this time, I've upgraded to ALS, so they're going to come in, check him out. I would also plan on giving him aspirin. Are you allergic to aspirin?
No.
Have you taken it within the hour?
Not within the hour, no.
Okay, and then could we get that set of vitals actually for blood pressure?
Don't forget that it's probably better to do a focused physical exam before you make a plan for treatment.
Okay, okay. All right, so I'm just gonna poke around here and we're gonna see if this causes any more pain, okay?
Okay.
All right, so you said that you're having chest pain on your left side, right? When I press here, does it make it any worse?
No.
Okay. And then I'm just gonna go on your sides here on your ribs. Can you take a little deep breath for me, please? All right, does that cause any more pain?
No.
All right, and I'm just gonna go in the center here and push down. Pain there?
No.
Okay. Is there any listen to your breath sounds on your back? Okay. All right, I'm just gonna lift up your shirt here, okay?
Okay.
I have vitals on your.
All right, and go ahead and take a deep breath for me. Okay. One more. And again. Good. And again. And then one more. Good. And here. Okay. Breath sounds are sounding normal. So at this time, I'm not gonna put him on oxygen, so long as my, oxygen stat is okay. Do we have vitals on
Yes,
that point,
yes.
Sure.
Blood pressure 132/88. Respirations were 18. Pulse was at 72, and then pulse ox was 98%.
Respirations for what, sorry?
What was it 16?
16, okay. Alright, so now I've done a little physical exam on you, I'm gonna go ahead and try to administer aspirin, see, so that you're not allergic to it, you haven't taken it within the hour, your blood pressure is looking fine for taking it, and then, have you had any black tarry stools or any, blood in your vomit?
No.
Coffee ground, vomiting, anything like that? Alright, so I'm clear to go ahead and give him the aspirin. So I'm gonna give him 4 tablets, 324 milligrams. So I'll give that to you. I don't know. You actually go ahead and have it here, but yeah, so I give you 4 aspirin. Go ahead and chew that for me. Don't swallow it yet. Okay, perfect. Oh, thank you. Should I take it out?
Sure.
Okay. Alright. Are you prescribed any medications?
I'm prescribed nitroglycerin, but I haven't taken it today.
You haven't taken it today, okay. Anything else?
No.
Alright, do you have any allergies?
No.
Okay.
There you go.
Thanks. Thanks. Okay. Alright, so you're prescribed nitroglycerin, you haven't taken it today. Your blood pressure is 132/88, so we're okay to take it there. Are you taking any erectile dysfunction medication?
No.
Okay, and do you guys remember? Right, I just would have to take a look at your prescription. Do you have your prescription here?
It's inside.
Oh, you got it right, you hand it to her.
Oh, okay. Alright, is this you?
Yep.
Okay, and the expiration date here is totally fine. Right dose. Alright, so let me go ahead and administer the nitroglycerin, tablet form under the tongue. So we'd again let that happen, and then if he's not, we wait 5 minutes and then give another dose.
Okay.
Wait another 5 minutes, give another dose.
Patient slouches over in the chair.
Patient slouches over in the chair. Okay. Can I switch to?
Well, what would you do if you did
Okay.
that?
Sir, are you okay? Are you okay?
Unresponsive.
Alright, go ahead and check his carotid.
No carotid pulse.
No carotid pulse. Okay. Should I switch? I guess you would pull him off the chair at this
You
point.
would, and you'd have to figure out how to do that.
Okay, so guys, if you want to take his legs here. Yep. Alright, we're going to go ahead.
Hold on a second. A better lift, if you're doing this from behind, is to come like this. Grab their arms like that.
Okay.
That's how you do that lift.
Okay.
This lift, you can slide out.
Okay.
This lift, you're not going anywhere.
Okay.
And when you do this lift, you're close, bending with like this, you're not hunched over like that.
Okay.
I won't have you do that lift, but that's how you do that, to the ground.
Okay. So you don't want us to do it right now?
No, no.
Okay. Do you want us to just move?
Go ahead, we're on the ground now.
Alright, can you go ahead and grab oxygen for me, please, and the AED? Actually, no, you already checked pulse.
You already checked pulse.
Alright, so if you can start compression for me, thank you. Alright. Fire 28322, confirm CPR.
Good. 25.
30, keep going.
Alright, open tank here, valve.
What you're at when you.
Stay clear of patient. Begin CPR.
There you go.
Stay
Alright,
clear of
analyzing.
patient.
Clear.
Analyzing. Stay clear of patient. Shock
Alright,
advised.
clear.
Shock
Okay,
delivered.
back on.
Begin CPR.
So we're gonna go ahead and get it on oxygen.
Yep.
For the bag valve
It's
now,
already
set
flowing.
25, perfect. Alright, at this time, do we have, we don't really have any
25,
family or
26,
bystanders.
27,
Okay.
28, 29, 30.
Stop,
Good breath.
Miriam. Good, how'd you do?
Good, awesome.
How did you do, peanut gallery? Nailed it, right? At any time, did this patient have a problem with the airway, breathing, and circulation that you didn't immediately identify and correct? No. Did you do a very competent OPQRST and physical exam? Yes. Did you appropriately administer aspirin and go through all the contraindications? Yes. Did you appropriately administer nitro and go through all the contraindications? Yes. Did you get ALS activated at the appropriate time? Yes. When the patient went into cardiac arrest, did you appropriately manage that and go into CPR like you should? Yes. There's no better that you can do than that. Well done.
Yay.
Like, maybe smoother next time. Otherwise, yeah.
This is, if you ever have an idea of becoming a paramedic one day, when I was tested and hired here, I had this scenario. This is a skill station to see if I was a worthy EMT to be trained to become a paramedic. Because this shows that you know what you're doing, you know your priorities, you can evaluate and treat a stable patient, and you can transition into being a lifesaver competently. So if you get this right, you're at the caliber of moving on in your career. Also know, I train other paramedics. Getting that OPQRST interview, physical exam is hard. Like, new paramedics suck at it. We have to teach them how to do it. So if you're good at that right off the bat, that's great. Appreciate that it's going to take time and practice and experience to really get the interview flow and all that stuff covered. Most important things, of course, is BMT, airway breathing, circulation, good CPR. Good.
Sorry, I have a question. So with, as far as checking the script, making sure, instead of saying, is this you, can you just get verbal?
Yeah,
Can I have
and
your
the
first
whole
last
point
name,
is, it's
birthday?
gotta be there, man.
Yeah.
Right, is this your nitroglycerin? Okay.
Okay, I